So today we're really happy to see that the massive vaccination campaign is going well, and all the population of Montreal of 70 years old and older have been invited to take their appointment. At the time we're speaking, the campaign has started in December, and we have administered in Montreal more than 125,000 doses. It's more than 62,000 healthcare workers that have been vaccinated for their first dose. We've finished the vaccination in CHSLD and elder residency, and also the vaccination that was associated with the outbreak that we had in different homeless shelter with more than 1,100 homeless person and 400 community workers that have been vaccinated. When we're looking at the vaccination coverage for the 80 years old and older, it represents at the time we're speaking 35% of them that have been vaccinated and 11% of the 79 years old. So, and it is going to progress rapidly because we have the doses to administer to them. So vaccination is an important tool for our battle against the COVID-19, and it is more important in Montreal, knowing that we have the variant that is that is in Montreal and associated with different outbreaks. So knowing that we may be seeing a third wave ahead of us, it is important to protect the most vulnerable population as soon as possible. So March is associated for us, it's a month of suppression of the variant and massive vaccination or acceleration of the vaccination campaign to protect as many people as we can. So the epidemiological situation is stable. We have attained a plateau with 2,700 new cases last week. It's a little increase. The new cases are mostly associated with school-aged children and the group age of their parents, and we are seeing a pattern of transmission that is outbreaks in school and high transmission in the households. We have seen a decrease in the number of our outbreaks with 324 current outbreaks, mainly in workplaces and in schools, and a decrease that is still going on in our healthcare setting, CHSLD and elder residency. So it is quite positive to see that the vaccine has done its effect. As Minister Dubé told us, we're seeing a calm, but maybe ahead of us we're going to have a third wave or a storm, as he's saying. So we're working really hard to suppress the introduction of the variant. Last week, the variants represented 12% of our new cases, and in the last couple of days, it's around 15% of new cases. Most of our variants are in specific neighborhoods, Côte-Saint-Luc, Snowden, Côte-des-Neiges, et Outremont. And we're managing many outbreaks associated with variants, 43 in schools. It may seem important, but being more aggressive when we have one case of variants in a setting, a workplace or school, we declare it as an outbreak. So 26 of those schools, they only have one case. So we're not seeing a lot of schools where we have more than 5 cases associated with the variant. So it is a positive sign. We also have 7 outbreaks in daycare center, 28 in workplaces, and 1 in CHSLD and 1 in an elder residency. So we do encourage the population to support their elders, family, or if you know someone in the priority group, to help them for their appointment or to get to the vaccination center. And of course, we want to remind that it is important to maintain and be vigilant and maintain protective measures. So wear masks during the transportation, open windows, keep distanciation, so maybe the person may sit at the back of the car, for example. And of course, after the vaccination, it is not a magic vaccine. It takes a couple of weeks to has its plain effect. So be vigilant, keep the public health measure in place, and by solidarity to the people who are not vaccinated, I think it's important to maintain those measures in place, distanciation and wearing your mask. At the end, I just want to say thanks to the healthcare workers that are joining our teams for this massive operation that is the vaccination campaign. And I want to say thank you also to the population who is coming who is answering positive to this campaign. And of course, it is still essential if you're a case or a contact and public health is calling you, our investigator are calling you. We want to tell you that it is important to respond because it's one of our tools to make sure that the variant is not going to progress rapidly. Thank you.